I know you know a lot about this area of symptoms and signs, but in general terms, what should people watch out for? What should men watch out for who are worried about prostate cancer?
Going to the toilet at night, difficulty starting, difficulty finishing, interrupted flow, backache, generally feeling exhausted, all of those things. If you go to the doctor with urinary symptoms, there's only a 30% chance that it's going to be prostate cancer. But if it is prostate cancer, the chances are it's already spread to somewhere else. There are no real symptoms of early stage prostate cancer. And that's a real problem because there's no screening for it either.
What do you think of the merits of the PSA test?
I think it's really important that people who are 50 and over have a PSA test, and it's their legal right to. The arguments against, I know all of the arguments against the PSA test. Overdiagnosis, stress. Well, what's the stress when you tell somebody that they've got advanced prostate cancer? You know, I mean, that's pales to insignificance.
Do you think it's a test that should be widely offered as a national screening program?
Yes, I do, very much so. There are major issues about not being able to tell a pussycat from a tiger. But there are also ways of dealing with that. If your urologist is someone that knows what he's doing, if he's a good one. If you have a Gleason of 6 or below, then... Just
to explain to the viewers, Gleason is a staging assessment which ranks the severity of the cancer.
Yes. With prostate cancer, you have when they take a biopsy, you have a Gleason score, and it ranges from 1 to 10. And on that scale is how aggressive the prostate cancer is thought to be. If it's 6 or below, it's not really an aggressive cancer. In fact, recent thinking is that it shouldn't be called cancer at all. If it's 8 or above, then it's aggressive prostate cancer, and it definitely needs treating. The real grey area is 7, because that's in the middle, and you don't know whether to do something about it or not. And that is something that your urologist really should know about and talk to you about.
Because I know there's a scientific approach which will surprise some people listening, which is watchful waiting, which is a monitoring strategy where active treatment's not given now, but they keep an eye on things with some intensity. And that's a little bit controversial, because if you're the patient with an overt cancer diagnosis, a lot of people feel uncomfortable with just a monitoring strategy.
Well, if you've got a Gleason 6, you should opt for its active surveillance.
That's the one.
Yeah. That's rather more intense than watchful waiting. Because all of the treatments for prostate cancer have quite unpleasant side effects. And unless they're really necessary, you don't want to put yourself through that. So active surveillance, if that is an option, and your urologist will tell you whether it's a good option or a bad option, or they should do, then that's a good option to go for.
Mm.